Thank you, Mr. Chairman, for allowing me the opportunity to testify today. Parkinson's disease is a progressive neurological disease that can rapidly affect life quality. It currently affects more than 1 million Americans. The Department of Veterans Affairs estimates that 110,000 veterans have been diagnosed with Parkinson's disease. While the exact causes of Parkinson's are unknown, many veterans develop the disease after exposure to Agent Orange and other chemicals while serving our nation. There is no cure for Parkinson's. While medications can help slow the disease's progress, treatment options are very limited. But we do know that one of the most effective tools against Parkinson's isn't a medication at all. It's physical exercise. While there are many different types of exercises that have been shown to be effective against Parkinson's, patients in Western New York in my district find that boxing, yes, boxing, has been particularly helpful in slowing and even reversing the effects of their illness. Unfortunately, boxing training and classes remain inaccessible for many Parkinson's patients, including many veterans. For example, my constituent, Dr. Patrick Welsh, a retired Marine Corps veteran, was recently diagnosed with Parkinson's disease as a result of his exposure to Agent Orange during his service in Vietnam. Dr. Welsh's physician recommended that he seek therapy at Parkinson's Boxing, a boxing gym in Buffalo, New York. This gym is dedicated to offering boxing therapy to people with Parkinson's. Their training protocol has been developed for those with Parkinson's, and they have seen remarkable results with patients of all ages and all stages of the disease. Parkinson's Boxing Program has been endorsed by the Director of Movement Disorder Clinic at the VA Hospital in Western New York Healthcare System. My predecessor, former Congressman Jack Quinn, and his brother, Jeff, have spoken publicly of the benefits of boxing to alleviate symptoms associated with Parkinson's. Given Dr. Welsh's physicians has deemed this therapy to be necessary under the Missions Act's community care provision, this should be a covered service. Yet, despite all the evidence, the VA would not cover the cost of Dr. Welsh's therapy because Parkinson's boxing is not recognizable as a billable service. Mr. Chairman, I strongly believe veterans should be able to seek care at facilities like Parkinson's Boxing as a covered VA benefit. The VA acknowledges the benefits of the exercise on Parkinson's disease, and we must not allow the red tape to get in the way of veterans' ability to access the therapy they need. Mr. Chairman, in closing, I urge this committee to please consider the matter further, and I look forward to working with you on ways we can make innovative treatments for diseases like Parkinson's accessible to all veterans. Thank you, and I yield back, sir.
Well, thank you, Representative Higgins, for that very intriguing presentation. I looked over at my health staffer, and we're intrigued, and we'll be looking into this. So thank you so much, and I thank you for your commitment to our veterans.
Thank you, Mr. Chairman.